Guys, welcome into this kind of unique video. You guys may have noticed in my channel, I sometimes will speak and have little long form, kind of small long form conversations with veterinary professionals. And this opportunity came across my desk recently to speak with one of the, dare I say, lead veterinarians involved in the research and development of the Loyal products, which you watching this, the viewer, may have come across. I've been seeing more and more of Loyal's kind of networking recently and announcements and whatnot. So I wanted to take this opportunity and speak with Dr. Ellen Ratcliff, who is I believe, the vice president of operations for Loyal, or veterinary operations, if I remember that correctly.
Yep, veterinary medicine and clinical.
Great. Um, Thank you very much for, and Kylie, thank you very much for introducing us as well. I appreciate that. You're in the background there. But I had some questions. I thought that, some of the questions that I keep coming to mind as I see more and more info from Loyal popping up is just some of the things that we're going to go through today, just standard questions. Um, I think a good starting place, whenever I talk to a veterinarian who's not just, I would say just, but a clinical veterinarian like I am, um, if you can just briefly talk about like your path between vet school and getting to where you are in your unique job, if you can maybe start there, and then we'll kind of branch out quickly into like Loyal and the specifics of the product.
Yeah, I love that. Actually, I tell people all the time the DVM degree is like the most versatile degree out there. You can literally do almost anything you want to, or any sector of business. I'm a mixed animal practitioner. That's what my heart is still. I did that for 17 years after graduating from vet school. And then I did the thing where I was like, I can kind of do this with one arm tied behind my back, and I'm not really sure what to do next. And also, student loans were eating my guts. And so I joined the Army Reserve. So I'm also an Army Reservist, another way to use your veterinary degree. And that scratched an itch for adventure and new things in the veterinary profession. And still over time, kind of feeling just burnt out with practice. And so I ended up joining clinical development at Kindred Bio. Just got lucky and slid into a role there. So that pivoted to, I worked on the parvo monoclonal antibody at Kindred Bio.
Oh, wow.
That was my favorite thing ever, until I came to Loyal. And it's just been really super wild to be at Loyal. And I was our first clinical veterinarian. I'm the longest tenured employee here, employee number 10. And I just kind of presented myself to the CEO at that time and was like, you need a clinical veterinarian on your team. And she hired me. So it's just been just a hoot and a half ever since then. Good
Yeah,
time.
it sounds like everybody seems to have a good experience working for the company thus far, from what I can tell.
It's a cool place to work for sure.
Yeah. So that's really cool. So we could probably do an entire episode on like career path, but the focus is this one is on Loyal specifically. So I think a good starting place to talk about the company and these novel medications is to first identify, like, what is the problem that the CEO, is Celine or Selena?
Celine.
Celine, um, the problem that Celine and others associated with the company high up, what what did they identify as the problem that they for an answer to first, if we can start there?
Yep. I think in the beginning, Celine's thesis was that uncovering the underlying reason why large breed dogs have a shortened lifespan versus smaller dogs would be revealing in finding a target for aging medications. So she's known from the very beginning that we wanted to create FDA approved drugs for lifespan extension. In the beginning, the thesis was the lifespan disparity between Great Danes and Chihuahuas, and what is it that causes that, and what's the intervention point that could change that in the future. So that was really the springboard. And then since then, we've established a pipeline of targeting other intervention points for aging as well.
Cool. And can you briefly talk about, like, why is it the opposite in dogs as it is in like natural mammals at large? So, like, for instance, in very broad strokes and general terms, like say an elephant lives a lot longer than a mouse does, right? A bigger mammal will live longer than a smaller mammal,
Yeah,
right?
for sure.
But that's the opposite in dogs. A big dog, a giant breed dog, is only going to live a handful of years, whereas dogs like my little 10-pound mutt terrier I found in the gutter 12 years ago, he has no signs of slowing down and is not breaking down in any way, shape, or form. So, why do these larger and giant breed dogs break down or have shorter lifespans compared to their smaller um, dogs?
Yeah, I suspect that there's a handful of reasons, honestly. We've done large breed dogs a disservice, by kind of selecting for the size and not so much for longevity or health. And that's a human problem, not a dog problem, but it's become a dog problem. The thing that we've really zeroed in on is that enormous push of growth hormone that leads to the size is also the same thing that also, after they're full grown, continues to drive aging. And this is a fairly well conserved mechanism in a lot of other animals, mice, rats, fruit flies, all of these things. And so driving that growth hormone and then subsequent driving of IGF-1 really is the target that we're shooting for with two of our pipeline drugs, actually, to bring that IGF-1 down, extend lifespan by kind of slowing the aging that happens in those dogs after they're full grown.
Okay. And so is IGF-1 pretty much like the mechanism of shortening their lifespan?
I
Is it
think,
a hormone level thing?
yeah, I think it's probably the resultant metabolic dysfunction that results from that high level of IGF-1.
Okay.
We're very deep on the metabolic thesis of aging. So as our a lot of our research has been on how dogs develop dysfunctional metabolism as they age, just in the same way people do. It's just that we've never really researched it, understood it, or talked about it in dogs. And so that IGF-1 axis in dogs drives insulin resistance, which is, I can talk about this in relation to our other drug too, but insulin resistance in humans, like this is widely, commonly, we all accept that insulin resistance in humans is a bad thing, and it
Right.
drives this like unraveling, pulling of the thread that can lead to diabetes and stroke and cardiovascular disease and cancer and hypertension. All of these things we accept in humans that insulin resistance causes, that can shorten lifespan for sure. We just haven't talked a lot about that in dogs, but we believe that there's a pretty similar set of things that accompany metabolic dysfunction in dogs as they age.
Right, right. And then combined with the fact that just being, from my experience as a neurologist, I see these gigantic dogs who can't walk anymore and, piling that onto all these metabolic and endocrine problems that they're having, perhaps, or genetically, you add immobility onto that and you've got a recipe for innate and like extrinsic shortening of lifespan. Just you can't take care of these dogs when they can't move.
Yeah,
It's impossible.
that becomes a real barrier. And I think that it there may be some deeper ways to look at this, as IGF-1 is a really super important part of growing, and growth hormone IGF-1 really super important part of getting those dogs to adult size, getting their bones to where we want them to be, their muscles to where they want them to be. But ongoing high levels of IGF-1 can also drive inflammation and just kind of be a home wrecker around the body,
Yeah.
honestly. So kind of solving it at the root versus trying to address it once you've got a dog who's immobile and can't get themselves up off the floor is
So the problem is giant breed dogs, their IGF-1, their levels maintain high throughout their life, or it's just way more at the beginning to get them giant, or is it both?
both.
Okay.
IGF-1 naturally falls off as dogs age, but larger dogs have kind of a linearly increased IGF-1 as well. So
Okay.
it's a fairly consistent mechanism that lowering IGF-1 in mice and other laboratory species extends their lifespan. We believe the same should be true for dogs.
And is that true in people as well? If you manipulate that hormone or measure it just innately in people, like longer lived people tend to have lower levels of this hormone?
Yeah, that's
Okay.
actually a conserved mechanism.
Yeah. Okay. Um, so it seems as though, it brings up a lot of like ethical questions about like the creation of just as big a dog as possible over the years. And it seems to me, and tell me if you agree or disagree, that we've kind of backed ourselves into a corner here of just creating as big a dog as we can, trying to maintain that feature. And what we've done is just, OD these dogs on IGF-1 in some ways, if I could summarize it that way.
Yeah, I think there's definitely a discussion about the ethics of selecting if
Yeah.
breeding for these kinds of things. But I would also say that our drug LOI-001, which I know you're familiar with, we're looking to target dogs in the 40-pound range. So it's not just the giant and large breed dogs with their elevated IGF-1. We believe that lowering IGF-1 it will extend lifespan on the whole in large breed dogs.
Yes, that's good that you segued for me right there. Thank you very much. But I want to get into like there's different loyal products that you're developing, and there's different targets and different sizes of dogs that you're trying to help. So, maybe if you can, for the audience, talk about the different products and like the first one that's coming down the pipe, and we'll start there and just kind of branch out from the
Okay.
short term and long term goals.
Yep. So the first drug in our pipeline was LOI-001, and was the original kind of seed drug to start the whole thing, thinking about the overexpression of IGF-1 and lowering IGF-1 to extend the healthy lifespan of these dogs. And then once we really became clear and understood the mechanism that lowering IGF-1 is actually just really improving metabolic health in those dogs, we also have a second product that we call LOI-003, which is a similar mechanism of action, different drug, different mechanism, but similar end result with lowering IGF-1. The 003 drug will be a daily tablet, and the 001 will be a long-acting injectable. So those are the two kind of targeted at bigger dogs drugs that we're working on.
Okay.
And then the third drug we call LOI-002, and this is the one that's actually the farthest down the trail on the development cycle and through the FDA process. It's currently in the pivotal study, and it's dogs 10 years of age and older, so older dogs, and 14 pounds and over, so getting down into the little dogs. And this drug similarly addresses metabolic dysfunction, but a completely different mechanism.
Okay. And are you able to speak to any specifics as far as mechanism
Yeah, a
at this
little bit.
point?
A
Okay.
little bit. Basically, the way I think about it is sensitizing to insulin so that you're bringing insulin down. We think any decrease in insulin has health benefits, and basically preventing that gradual over time increase in insulin that does start to do the same things in dogs as it does in humans. Dogs don't get heart attacks, but they definitely do get adipose dysfunction and redistribution of their adipose tissue to their visceral space away from their subcutaneous space, and that accelerates this aging phenotype that we all kind of accept in humans. Same thing in dogs.
Okay. And so does the drug act to inhibit IGF production or its effects on the body, or
The
both?
The 002 drug has nothing to do with IGF-1.
Okay, okay.
It's yeah, since it's the little dog, targeting
Yeah.
little dog targeting drug, not an IGF-1 mechanism at all, more an insulin sensitizing and improving function of the adipose tissue. I think, adipose tissue is its own entity in the body. We kind of forget that sometimes, and as dogs age, their adipokines trend to be less healthy and less beneficial. And so addressing that adipose tissue function and the sensitization to insulin, we believe will really extend the period where dogs feel well and are active and doing good.
Yeah. As I age, I become more and more aware of my own adipose tissue. I'm
Reach.
I'm finding out. Cool. So, there's been safety studies done thus far. Can you speak a little bit about to any side effects and any adverse events, what are concerns? Because I know tons of people that's the first thing you think about with a
Yeah.
novel drug, right?
We'll talk about 002 primarily since it's got the most data and is the farthest down the development pathway right now. The Just as a little bit of backgrounding with the 002 product, all of our products, but the 002 product in particular, we're pursuing the expanded conditional approval pathway that's available through the FDA. So with that program, you're allowed to kind of bring a drug to market before the full effectiveness package is completed. And the reason for that is because a lifespan study in dogs is very long, very complicated. So the requirement for completion of safety and chemical manufacturing and control, chemistry manufacturing and controls, and all of the data is exactly the same. So these drugs will have the same safety package as any other drug that's FDA approved. The only thing that's pending is the effectiveness data. So as far as safety goes, safety is like has to be the number one most important thing with aging drugs, because if you have a dog and you're treating a disease, you accept a certain amount of side effects or risk associated with a drug in order to treat the disease. But if you're trying to delay aging and the frailty and decreased quality of life that comes with aging, you're treating a healthy dog. So side effects are just kind of unacceptable, honestly. And so that's our baseline. And the drug,
That's a challenge.
yeah, it is.
Yeah.
You put anything in a body and you could wind up with side effects. But
Yeah.
I'm really super proud and like pumped to talk about specifics of the safety of the 002 drug as we go along. I can't tell you specific things right now. We're working on submitting our safety dossier, and the safety of this drug is just really remarkable, honestly.
Really.
As we have our pivotal effectiveness study, the STAY study, is ongoing right now. We're right at 1,000 dogs enrolled in this study. 10-year-old dogs, 1,000 10-year-old plus dogs taking this drug for many of them over a year now. Just a neat way to flesh out the safety in a dog population that's really never been done like that before to this scale, pre-approval.
Cool. And so if you can maybe, so that was that was Loy 2. For 1 and 3, any comment as far as like any safety or adverse event concerns for those?
They're not as far down the development pathway, so I nothing specific I feel like I should throw at you, but I just know that the standard is the same.
Yeah.
Aging drugs have to be safe.
Right. Right. Um, one thing I've had some people kind of ask me about in my own question too is like what would be the envisioned, like, dose regimen for these medications? Like, from a 'cause this is something that, the general practice doctor is gonna be administering, your primary vet, right? So, is this where they come into the clinic, like, once a month or once every 6 months? Or you mentioned pills and injections before, but can you speak a little bit about, like, what this looks like to a pet owner getting this medication into their pet?
Yeah, the 002 drug is a daily tablet. It's a flavored tablet. Dogs dig it. They literally just receive it like a treat every day for the most part. You get the occasional persnickety pooch who doesn't want to eat it, I'm sure, but overall, pretty good palatability and easy to administer. Just a daily tablet.
Okay. Do you know that if it, like, breaks up or splits or something like that, it has any issues with absorption, or is that
Yeah, well, of course, the pathway to FDA drug approval, which is get my plug in now that FDA drug approval is a very high bar because of stuff like this. In order to go to market with a drug, you have to have very complete, pharmacokinetic data, dissolution data, all of those things to prove that the drug behaves predictably. If the tablets are splitting, which that all of that will be really like nailed down solidly with the FDA.
okay, and then and so that's for 2, and so for 1 and 3, are those the injectable ones?
001 is an injectable formulation, and 003 will be a tablet also still in
Okay.
formulation.
Okay, and how often would those be given? Um,
Tablet would likely be once a day. A little bit of to be determined on some of these things yet, since they're not as far down the development pathway. And 001 will be a long-acting injectable, also TBD on duration.
okay. And do you have any sense of, like, cost, or what these will be? Any of these products, to the pet? Well, it's to the pet owner, it's gonna depend on what the doctor marks it up as, but, can you comment on cost? Is that even something you know about right now or
Yeah,
project?
I don't have any specifics to share with you. I will tell you that really one of our values is accessibility of these drugs. We do not want to develop aging drugs that are only available to a very small minority of people due to cost. So
Right.
pricing is really something we're putting a lot of our heart and thought into, so that we get the price at a point where accessibility is really achievable, which is a service to veterinarians too. Veterinarians get tired of having novel therapies or new things that owners just would have to struggle to pay for. So it's a makes veterinarians happy when owners can afford medications too.
Yeah. It draws the whole kind of production of it draws a little bit of a comparison in my mind that they're different drugs, but to like Ozempic and all those things in people that have just come out, just because I guess that's the latest like person quality of life drug breakthrough.
Yeah,
Have you seen when you dig into like some of the benefits of those drugs, you find helpful um, treatments to other conditions that people are reporting, like addiction and gambling problems, and these compulsive behaviors tend to go away. With dogs, have you guys noticed any like good side effects that you weren't expecting in terms of like what this does to their biochemistry or their mobility or anything like that?
I think it's a little bit early to say because we won't be analyzing the data from the stay study until the end. It's a double-blinded study, placebo-controlled. So although we're tracking the study every day, we have no idea which of the dogs are getting the drug and which of them are getting placebo, and we won't know that for several years. Having said that, um, the benefits of drugs that mimic calorie restriction, or some of the biologic pathways of calorie restriction, we know can be really life changing. I'm sure you're familiar with the Purina study they did, where they paired 48 Labrador puppies into two groups. One group they calorie restricted, the other they did not, and they followed them through the duration of their life. Calorie restriction is a repeatable way to extend lifespan. In that
Yeah.
Purina study, the dogs lived, I think, a mean of 1.8 years longer. They still developed all of the same diseases of aging, but they developed them like 2 years later. And when all of the regular fed dogs were gone, there was still 9 of the calorie restricted dogs um, alive. Their lifespan was so much more increased and improved. Their health span was improved from this. And so really, I think the only comparison I would say to the GLP-1 drugs is just the calorie restriction is definitely beneficial for health, and but it's also something that none of us are going to do to our dogs. I love
Yeah,
when
I mean,
my dog eats; it makes me so happy. She's so cute. She crunches so cute, and
yeah,
never going to calorie restrict my dog. But if I could tap into the benefits of that through other biological pathways, like lowering insulin and those kinds of things, absolutely.
yeah. Have you, any, like, changes in their own intrinsic appetite with these drugs?
No,
You think? Okay.
um, there the hope is that honestly, when owners give these drugs, best or medium case scenario is you notice nothing. Best case scenario is lowering, um, improving metabolic function makes dogs feel better. So,
Yeah,
too early to say that yet, or to have data that supports it really.
yeah. And I think you mentioned this earlier, but if you can just, perhaps repeat it, the age that at which we start giving these to dogs is what per loyal 1, 2, and 3?
Yeah, the two large breed drugs, 001 and 003, are 7 and over.
Yep.
And then the 002 drug is dogs that are 10 years and over. So
Okay.
part of this is like you can imagine strategically it might be more beneficial to give dogs drugs that improve their metabolism when they're younger. And part of
Right.
this is just strategic decisions where you only have so long to run a clinical trial
Right.
within
Right.
the expanded conditional approval period. So it would be just impossible to start in dogs that are 5, for instance.
Right.
Um,
That
with
yeah, that was gonna be my where I see this going is people are gonna be, like, clamoring for this, or at least some people, and they're gonna be wanting their vet to give it to their dog at the age of, like, 2, because they're gonna see it as a preventative measure rather than, giving it along the way that you did to develop the drug, right?
Yeah, I
So there's
think
gonna be this push towards earlier and earlier onset of, like, starting the medication.
Yeah, I think that's a valid point, and honestly, I can't disagree with the logic that earlier might be better. Of
Yeah.
course, in the expanded conditional approval period, veterinarians are very comfortable using drugs off label. That's like our that's just what you have to do to survive in a veterinary clinic.
Yeah.
But during the expanded conditional approval pathway, the drug has to be given on label, and then over time, once we've got a little bit of growth under our belts, and we're more prepared. Looking at younger dogs feels like a natural progression.
Yeah, I'm excited to see like if this gets out there and is in broad use as much as Serenia and every other new drug that's come out during my career. Um, what we're going to see dogs living longer. There's going to be some age related issue that then becomes a higher incidence, like the way we see dementia being a problem today. Whereas 20 years ago, when I started veterinary school, you didn't really deal with dementia because dogs were passing away earlier in life, I think. But it's just a question. I mean, it's not something you could probably directly answer, but it's just one of those things where I wonder what is the next problem as a result of dogs just living into their, mid to late teens on a regular basis now, right?
Yeah, I think that the thing to keep in mind is that it feels like the aging science space is trying to do this thing with like immortality, or just like making people live to be 120 or something like that. And
The Brian Johnson guy
yeah,
online
I
is
think that I think that phenotype of aging science has kind of biased everybody to think
right.
like
Holding his bag of plasma in front of him.
yeah, yeah. We're not shooting for immortality or anything
Right.
crazy. We're talking about and really, because the majority of dogs die by euthanasia, the only way to extend dog lifespan is to extend the period of their life where they feel good and they're healthy and they're mobile.
Yeah.
And so I don't know that we're going to uncover a new cause of aging associated diseases, but what I think and what the Purina research showed us is that the dogs will still die of the same things, but we hope that they'll push down the trail and not have that long period of feeling bad and having arthritis and being immobile and all of those things. So
Yeah.
that's really more the goal.
Yeah. Have you gotten any or felt any pushback from there's a sect in the veterinarian pet owner community that's very, naturalistic, holistic, and anti-drug in many ways, anti-pharmaceutical. Have you felt any of that pushback at all at the corporate level or the research level? Has that gotten up the chain at all?
I think there's always going to be people who feel that way, which um, is just in the background. You can't make everybody happy all the time, but I would say from my perspective that there's actually an instead of saying either this or this, we should say this: healthy diet, lots of exercise, natural, whatever it is that you like to do, and consider the possibility that intervening on the normal aging process could extend your dog's lifespan in addition to the things you're doing. So I
Yeah.
feel like the approach is an and approach, not an or approach. Um,
Yeah, I totally agree with that, and also the one thought that's come into my head recently is that, like, the population of animals we are trying to help are not naturally occurring animal. These are bred to be specifically a certain size. So, I think there's a naturalistic fallacy there because we're not even at a starting point of what this would spontaneously occur. So,
yeah, I think that's true. But even just for your average 15-pound mutt, we know that as a 15-pound mutt ages, their metabolism becomes dysfunctional. And if you can
yeah.
correct for that, and that is your best friend, I don't think that's an ethical dilemma for me at all.
Yeah, I mean, do you think, and just kind of following up on one of my prior questions, I mean, could you envision a scenario where like a diabetic dog that goes off insulin with something like this?
we're
Is
not
that a
we're not testing the stay study does not include diabetic dogs because diabetic dogs are hard to regulate, and you don't want to be throwing, experimental medications onto their path to get regulated. So, I do think that type 2 diabetes is just such an uncommon thing in dogs in general, but I do think that any regulation of lowering insulin, I think, is beneficial, and how that fleshes out in that population of dogs over time, I don't know.
Yeah. Any thought process in looking at these sorts of medications and drugs in other species like cats?
Well, I'm a hardcore cat person.
Okay.
Yeah, this is the question we probably get most often. Um, as long as I work here, I'll always be in the background saying, "What about cats?" But truth of it is, we're a very small company. We're a biotech startup. We're pre-revenue. Um, one thing at a time. We're really focused on dogs,
Yeah.
right?
Are you taking open investments right now from other people? How can I get involved in that?
That's a that's a question for our for our business people, but
Okay.
um, we are. Yeah, we're funded by venture capitalists, and it has been a wild ride. It'll be nice when we can be a little larger company and have more people working here to help us grow our dreams all the way. It's exciting
Well,
stuff.
if you can put in a word, I wouldn't mind being in there in the seed round or round 1 or 2 after that. I mean, just, if you
Okay.
wanna put in a word for me.
I'll drop a note to Celine.
Oh, yeah, I'll be there at IPO if it gets to there either. Um, cool. Is there anything else that you would want to get out to people that I haven't asked about Loyal?
I'll send you a link to a new paper we published last month, looking at health span markers and their correlation to clinical outcomes like quality of life and frailty. I think it's
Interesting.
honestly, um, I think what our goal is to eventually educate veterinarians about how these things happen to the point that you can't ignore it once you know it, because it could change the way you practice medicine on geriatric and aging dogs. So
Okay.
I would love for your listeners to check out the new paper. Very interesting correlations between alk-phos, ALT, insulin, uh,
Really? Okay.
yeah, with quality of life scores, and maybe a new one for people, which is adiponectin, looking at adiponectin levels and with those things as well. Pretty um, first time. First time people will have seen a lot of this, and I think this is what's coming: is a better understanding of metabolic function in dogs.
Yeah. Yeah, I see it as like the back half of a dog's life is what we're trying to figure out. We got through the first half, which is just getting them through like traumas and genetic diseases and congenital malformations, myelina work, herniated disc, basically things that are just genetically going to harm them the first 8 years. And we figured that out pretty good. And now this is where we start figuring out the back nine. Like this is, how do we address this second half of their life once they've gotten through all the stuff that I, learned in vet school that
Yeah,
really was all we cared about in vet
I
school was
know.
just
I know. I remember in vet school that they were always like, old age is not a disease. And at this stage of my career, I'm like, okay, well, it's not a disease, but it is the number one predisposing factor for every single disease that kills you. So,
right.
yeah, so it feels like something that's long overdue to be addressed, frankly. And I'm excited about, hopefully changing the way veterinarians address aging. It's an exciting time to be a veterinarian.
Do you remember back in the day when like a 7-year-old dog would be just, oh, he's too old, we're just gonna stop?
Listen, I was in rural mixed animal practice. That was
Yeah.
every day of my practice life.
Yeah, I went to school so I graduated in 2009 from Georgia. I'm from Georgia, and I remember, I was a tech, I call it a pseudo tech when I was in high school and whatnot, but the way the whole industry has evolved for me, the late '90s and early 2000s into the last, like, 10 years or so, has gone from like, "Oh, yeah, just 7, 8, you're over the hill, that's just too old to do anything," to, "I just did a neck surgery on a 19-year-old in Pinkonese last year." And
That's
it's
amazing.
it's like it's completely different paradigms
It
nowadays.
is. It's really awesome. And I for my I depopulated animal shelters with parvovirus, as a practitioner. More than once I did that, and,
Yeah.
and losing entire litters of puppies or entire households of dogs because of parvovirus, and, so although I get fewer warm fuzzies, doing research than you get doing surgery on a 19-year-old Pekingese, it's like
Yeah.
this research, I think, the has the real ability to just change the way veterinarians work,
Yeah.
and
I
it's
mean
for the dog's benefit and veterinarians' benefit. We all watch these dogs age and have these slow burning chronic diseases that are just horrible, expensive for the owner to maintain, hard for you to even know what to do next. And if we can shorten the period that they have those chronic diseases to just the very, very end of their life. We've really done a service for
Yeah.
dog and veterinarians.
No, I'm excited to see where this goes. And do you have are you envisioning like 2025 or 2026 when things start coming to market?
Yep, the first drug that's closest to approval, Loy 002, we're still hoping that it will be conditionally approved and on the market within the next year.
Oh, wow. Interesting. So maybe a year from now, we'll start seeing the effect, and then another year or two, and then we start yeah, no, it's gonna be crazy.
Yep.
Um, awesome. That was great. I appreciate you taking the time to talk about this. And I know you guys have been doing like a full court press for like social media engagement and exposure, but like I think it's great. Like people need to be aware of this and know it's coming down the pipe for sure.
Yeah, I think the one thing I forgot to mention, if I can have a couple more minutes, is
Yeah, absolutely.
the reason that we started this press push, or that you've seen a lot of press recently, is because the Loy 002 drug received reasonable expectation of effectiveness from the FDA.
That's
And
right.
that's one of those check boxes on the road to expanded conditional approval. But basically, they've looked at our data and they believe, like we believe, that the drug will extend health span and lifespan. And I think that's a pretty big deal, honestly. The bar for FDA drug approval is very high, and for them to agree with us that they believe the drug will be effective is a pretty big deal.
Yeah, I mean, Librela got approved based on what really is the same study on two different continents, as far as I know. That's what they. So I would think that Loyal can get there too. I really see a lot of promise with this thing. So,
Yeah.
um, cool. Well, Dr. Ratcliff, thank you so much for coming
Yeah.
on the show.
Thank you.
My little YouTube channel here, guys. Everybody like and subscribe. Please share this video with as many people as you feel appropriate. I appreciate you watching, and we'll see you in the next video. Thanks a bunch.